So the main message I wanted to give here is that palliative care is part of mesothelioma and lung cancer care. You need to expect it wherever you are. And if you can't find it locally, then ask your physician to call the palliative care hotline. Ask. Don't just sit there and suffer. Well, let me finish the story then. What about Frank? So Frank had a long course of treatment for his cancer. Here's a photograph. I hope you notice that Frank now looks a little more ill. Sadly, his cancer was not put into remission by the therapy. And Frank now, the most important things, knowing that the cancer was getting worse, was to be comfortable and be near his family. And so he was referred for hospice care and was cared for by that hospice team for 3 months at home, continuing to do the things that he wanted to do. Frank got closer to dying, and as many patients do, it wasn't difficult. He simply lapsed into a coma, and I thought he was dying. I told his family I thought he had 2 days left to live. And because he seemed to develop a little more discomfort, we gave one of the pain medicines that helps a lot, corticosteroids like dexamethasone, and gave him the pill rectally because he was no longer able to swallow. I was sitting at my desk on a Tuesday morning. It was 7:30 in the morning, and I got a telephone call. It was Frank. I want to go to Pennsylvania. Well, what would you have said if he called you? This is a man I thought was dying. He wanted to go to Pennsylvania. This is not a family that could afford air ambulance. So in that silence, I said, well, why do you want to go to Pennsylvania? He said 2 reasons. My son is getting married, and there is no way that they can come and see me here and continue with the plans to be married because he and his wife-to-be are working, and there's no way they can take out that much time. And the second is that they had just had his first grandchild, and he wanted to see that grandchild. And on reflection, he said, well, there's probably a third reason. You know, I never did like the city. I would really like to be in the country. All right. So that sounds like a good reason. But can someone like Frank travel on his own? A commercial airline? No. His family was with him. The hospice team was with him. The important thing is that Frank, with enough approach to that, Frank did go. Prepared for what to do if he couldn't get there. If he died en route, that was a possibility. But he did. And if you were a guest at the wedding, you would be standing on the lawn watching the back deck of the home. You can see here, this is his son and his new daughter-in-law getting married. And if you look over here in the corner, here's Frank with his wife and the new couple. And here's Frank with his new grandbaby. Frank died the day after this photograph was taken. The reason I show this is to present the whole trajectory here, from the time Frank came first to the emergency department, across all the time of cancer care to make sure that relief of suffering was part of that. And this, in many ways, represents the completion of the best of care. Everyone feeling like everything that could be done had been done, and that important family issues were tied up. So for everyone, for those of you who are healthcare professionals, for those of you who are patients and families, you owe it to yourselves, your physicians owe it to you to make sure that palliative care is woven into cancer care across that continuum. Thanks very much. I'm happy to take any questions. So the question is palliative care part of CME for physicians? And the answer is yes. There are numerous courses in pain management, symptom management, given across the country now. California's legislature now requires all physicians practicing in the state to have education in palliative care. That is growing in other places. What is even more important is that half the hospitals in the country now have dedicated palliative care services. Cancer centers are now developing this, making sure this expertise is part of what they offer. So that's why I say everyone should expect this as part of their cancer care, and if they don't get it, ask. So the question is, has there been any pushback from oncologists in oncology centers? I think I would characterize that in 2 ways. The first is everyone working in oncology agrees that making sure that patients' symptoms are under control and that their emotional and social and spiritual needs are met is an important part of cancer care. Many people thinking they're doing a very good job and don't need help, despite the fact that patients still have unrelieved suffering. One of the challenges there is patients often don't tell the doctor how they're feeling. They wait and they tell the nurse. The second issue is that many doctors didn't train with expert specialist palliative care as part of their team. And it's hard to know what you're missing if you've never trained with it. So I expect the next 20 years to be very different than the last 20 years because this is now becoming a standard part of academic medicine. So I hope this current period will pass.